Every voice matters. Blue Lift is a podcast dedicated to address the issues that affect all of us, with engaging discussions with progressive thought leaders and experts as guests. Here's your host, Peggy Kingsbury.
Welcome back, everybody. It's another episode of Blue Lift. I really want to thank you so much for tuning in today. And if you like what you're hearing, I want you to make sure you share this episode with your friends and send us a note, too. In the show notes, there'll be an email where you can reach out. If you know a great guest or want to be a great guest, let me know. We're always looking for good folks to talk to. So today we have with us Dr. Michelle Fiscus. And is it okay if I call you Shelley?
You can, absolutely.
Okay, great. Because that's how I've known you for all this time. So Dr. Fiscus is a board-certified pediatrician and a public health advocate. She practiced general pediatrics in Franklin, Tennessee for 17 years, and then she began a career in public health in 2016. Dr. Fiscus served as the medical director of the Tennessee Department of Health's vaccine-preventable diseases and immunization program, and she also led our state's COVID-19 vaccination efforts until July of 2021. Dr. Fiscus has served as a senior health policy consultant for national organizations and served on the board of directors of the American Academy of Pediatrics. She is a proud graduate of Indiana University and Indiana University School of Medicine and completed her residency in pediatrics at the James Whitcomb Riley Hospital for Children at Indiana University Medical Center. So when you left Franklin, I'm surprised you didn't go back to Indiana.
Yeah, I think my mother-in-law would have loved if we'd gone back to Indiana. But yeah, actually the reason we ended up first in Virginia and now we're in Maryland is because at the time I was on the board of directors for the American Academy of Pediatrics and I had to stay in my region. And so the region was basically the Southeast. So Virginia was just as far away as I could get.
And still be in there. So now you're in Maryland. How far are you from D.C. now?
About 20 minutes.
Oh, wow. Close.
At like 3 a.m. So yeah, close. During rush hour, it's an hour plus, but I'm like 12 miles or something from DC.
Oh, wow. Okay. All right. So you're where everything is happening right now.
Yes, I am.
So I'm excited about this conversation because we're not going to go in depth about why you are no longer in Tennessee, but I think it's fair to say that it's not of your own doing. There were some decisions made around the state's COVID response. And I think it was at that point that I began to wonder, why is politics all up in our health care? I didn't really think those two things had a whole lot to do with each other than how it was paid for. Times have changed, and now I've learned that often that is the case. But what we really want to talk about today is your work with diseases that are easily preventable by vaccine. And just kind of a little background on why this is interesting to me for a lot of reasons. But one is I'm a very proud Rotarian. And as you know, Rotary has worked for a very, very long time to eradicate polio. And there are times when we've been extremely close to that happening. But because of geopolitical issues in some of the very remote countries where tribal leaders would not allow the children to be vaccinated. It just seemed like we would get, literally, there was one point in time, I believe, where we were one case away from actually saying polio is eradicated from the face of the earth. That's not the case anymore. It's back, sadly. So let's talk a little bit about vaccine-preventable diseases. Something like smallpox, for example, that qualifies as a vaccine-preventable disease, right?
It does. We don't have that anymore, thank goodness. It went the way that we hope polio will go or would go. But really that was the first public health vaccine back in the late 1700s to eradicate smallpox. And I think people lose sight of the fact that infectious diseases have played a tremendous role in the history of the United States. I mean, had it not been for smallpox vaccine, we might not have won the Revolutionary War. There's really a very deep history of the need to eradicate these diseases in just even the formation of our country.
So, since I don't have any kids, do babies now still get a vaccine for smallpox or no?
We don't vaccinate anyone against smallpox anymore. The only existence on the planet of smallpox is in some labs where it's kept safe, we hope. But other than that, I actually don't have a smallpox vaccine scar. I was born in 1968, and it was right around that time that they stopped vaccinating against smallpox. So, that's been 56, 57 years that we've gone without needing to vaccinate people against smallpox,
Well,
which
how
is
about that?
pretty amazing.
Yeah,
Yeah.
I'm
Yeah.
one of the boomers that's got the big crater in my arm.
Yeah, I do not have it. And as things often happen, policies change on the coasts and move in. So I was born in New Jersey, and so I didn't get smallpox vaccine, but I have friends who were born in the Midwest or in the South who were born after me that still did get smallpox vaccine. So it's all of that stuff is very interesting. But that's a disease that is no longer present on the planet. So outside of a bioterrorist attack where someone uses smallpox as a weapon of some kind, we really don't have to worry about smallpox. But Mpox, or that was first called monkeypox, is a sister disease to smallpox. And so the smallpox vaccine that was used to control that can actually be used for Mpox and to get that under control. So, those vaccines still have utility as we see new diseases emerge that often come from kind of the same family tree.
So, what's another example of a disease that used to exist but does not anymore because of vaccines?
Well, smallpox is the only one that's actually been eradicated. Now, there's plenty of
Okay.
diseases that have been eliminated. So, rubella, for example, has been eliminated from the United States. Um, Theoretically, we have elimination status of measles, but
Oh no,
the
we're
way
going to talk about that. Yeah.
the way we continue to move, we're at risk of losing that status. We don't see diphtheria. We don't see haemophilus influenza. In my medical training, I graduated medical school in 1990 and my residency in 1994. And in the late 1980s, we got the haemophilus influenza vaccine, which I'll hear stories from people who trained just a few years before I did of how every single night in the emergency room they were doing spinal taps on babies and getting just, pus out of them because they had H. flu meningitis. And flash forward to even just 5 or 10 years later after we started using the Hib vaccine, I have never in my career or in my training seen a case of Haemophilus influenza meningitis ever. It was almost like a light switch when we started using that vaccine widely in the pediatric population that we stopped seeing really bad diseases that have really horrible outcomes like H flu.
And is that vaccine still given to babies?
It is, yes. That is a bacteria that's still around. Obviously we still see mumps, we see measles, we see chickenpox, influenza, COVID, RSV. We now have the opportunity to be able to prevent a large number of RSV cases. That's the number one cause of hospitalization for infants, and we now have the ability to prevent that, which is wonderful. Um, but when I think about the diseases that I've never seen because of vaccines, it's mumps, diphtheria, polio, smallpox, of course. Um, I've never seen tetanus,
Oh wow.
thankfully.
Yeah.
Still around, and tetanus lives in the ground. Actually, I had a conversation with a parent in clinic who had never vaccinated her young child, and he came in with a gash in his leg. He ran into a metal pole out in the yard somewhere, and kind of tore into his leg, and it was through his pants and into his leg, and came in. to have that assessed, and the child had never been vaccinated. And I explained to the mom, he really needs a tetanus shot. And she said, oh, well, he was wearing pants, and so like the rusty metal rod never actually touched his skin, in her opinion. Um, and so I had to explain to her that, just playing outside in the dirt puts you at risk for tetanus. Tetanus spores are in the dirt. I love to garden. You digging up dirt. You've got kids out on playgrounds digging up dirt. And if they're not vaccinated against tetanus, that is a disease that when you get that, there's really no coming back from it. And again, 100% preventable with a vaccine. So, unfortunately, I didn't convince her to get him vaccinated that night. She promised she would have a conversation with her child's doctor about it.
Hmm. So, when did this big anti-vax movement start? Do you know about when all that started?
Well, there's been anti-vaccine stuff happening since the advent of vaccines back in the late 1700s. So you would see propaganda with there's a very famous cartoon of the physician who developed the smallpox vaccine inoculating a milkmaid while all the people around her in the cartoon are growing cows' heads and cows' horns and cows' tails out of their bodies, because the myth was that, well, if you got smallpox vaccine, then you were going to develop cow parts. So that has been around forever, but where we really saw this take hold was in the 1990s, when a now completely discredited physician from the UK named Andrew Wakefield had a paper published in a very prominent journal called The Lancet, where he literally looked at 12 children to try to make the case that there was a link between autism and the MMR vaccine. And this study was published. Again, it was 12 kids.
And now, what's the NMR vaccine? What's that one for?
The measles, mumps, and rubella vaccine. Thank you. And so it took 10 years for the Lancet to retract this paper.
And why did it take them so long? Because I have no medical background at all. I've been a patient. That's about it. But, my background is in criminal justice, and we look at a lot of studies, when we're looking at the causation of criminality. And I would never give credit to a study that had 12 people in it.
Right. Yeah, exactly. And so how, this is, like I said, this is a very credible, prominent journal, peer-reviewed journal.
Yes.
But yeah, to publish a study based on 12 children and try to draw a conclusion that there is a link between giving a child a measles, mumps, and rubella vaccine and them developing autism was just a complete stretch. And then to find out later down the road that Wakefield had actually received money by a company that was creating a competing product to the existing measles, mumps, and rubella vaccine. And so the entire study was flawed and was eventually retracted. But in that period of 10 years, this whole movement began. And, around the same time, we have internet and social media coming on. And so, it's not the 1700s where you have to pass a flyer by pony from village to village. It's, this immediate ability to share mis and disinformation. And controversy is very sexy and it sells, and people want to share that. People don't really have a reason to share that their fully vaccinated child is out playing in their backyard. Nobody really cares about that. But if you can find some kind of juicy, controversial thing, then you can kind of spin that up and get a lot of attention. And so in the meantime, Wakefield, who now has had his license stripped from him and actually lives in Texas now, has made unknown amounts of money on documentaries or mockumentaries that he's put together, claiming that vaccines are harmful. And that's really what the grift is. If you can find ways to discredit science, then you can find ways to monetize that. And whether that's supplements or helping with lawsuits or being witnesses and getting money for that, or writing books or putting out movies, all of that can be monetized then. And then that just helps you create a larger audience where you can continue to spread your mis and disinformation. I'm a pediatrician, and pediatricians have been in the trenches with this. I think for a lot of folks kind of that are in the mainstream, vaccine hesitancy really kind of came into play with COVID vaccines and all the questions around COVID vaccines. But for pediatricians, we've been doing this for 25 years, in talking to parents and helping them understand why vaccinating their children is so incredibly important. And this is really a very fragile ecosystem. When you have something like measles, that is the most infectious pathogen that we know of all of the things. You think about Ebola. Ebola's got nothing on measles when it comes
Oh,
to
is that right?
infectious. Oh, nothing.
How is measles spread? Because, I'm of the generation where I might have had a couple of friends who had measles, but I didn't. I had the only childhood thing I had, and I was born in 1959, was chicken pox. Did not have mumps, did not have measles. I think I have a friend or two I can remember maybe in grade school who had measles, but you just don't hear about, well, now we're starting to hear about it again. So I don't even know how one gets the measles. That's how old I am. We call it the measles.
No, that's fair. I remember my dad had everything. He just passed away this last summer, and he was 87, and he had measles and mumps and rubella and chickenpox, and I don't think he ever had diphtheria. But all the things that we don't have to suffer through and our kids don't have to suffer through. Measles is spread through aerosolized droplets. And so the thing about it is that the measles virus can suspend in the air for about 2 hours. So let's just say I'm in a room and I have the measles and I cough and blow measles into the air. And then 2 hours later, you come into the room unvaccinated. You have over a 90% chance that you're going to get measles from me, even though we didn't meet face to face and I was there 2 hours ago. That's how infectious it is. There's something called the R naught, which is a measure of how infectious something is. And it reminds me of the old shampoo commercial where, I told two friends and they told two friends,
Yeah.
so on and so on. You remember that one? So measles is kind of like that, and the R naught. And so the R naught for measles is 15 to 18, which means for every infected individual, they are going to infect 15 to 18 susceptible people. That's a lot. That's a lot of people.
And how
For
old is a baby
comparison,
when they get the measles vaccine?
1.
1 year, so 12 months.
So yeah, so they
So
have
between
12
birth
months
and
of
12 months,
vulnerability.
they're susceptible.
That's right. That's right. And that's where we see the highest rates of mortality from measles are in young children, because it's a very virulent disease. And
And
so
what does
the
the
death
measles,
rate,
what does measles do to you? I mean, what are the symptoms? What does it do to you physically?
well, the symptoms are high fever, and then what they call the three C's: cough, coryza, which is runny nose, and conjunctivitis. And then the rash that everyone thinks about, which actually comes about 3 or 4 days after the onset of the symptoms. One of the sickest kids I've ever seen, I've only seen measles once in my career, was probably about 10 years ago, a baby who had gone from the United States to India and left before they were old enough to be vaccinated, and then came back and was actually in my waiting room coming in for a well visit. And my front desk came back and said, this kid doesn't look good. You need to bring them back, and brought him back to a room. And I literally opened the door, saw the child, and said, I'll be right back, and went out and got a book down and flipped through the book to measles and reminded myself of all the things that measles looks like, because I have never seen it. And went back in, and this child was so sick and she checked every box. And I said to the dad, I'm really afraid that your child may have measles. And he said, Oh, I know she has measles. It's endemic in India. And so I knew that's what this was. And for him, it was not a big deal because it was something he saw happening in children all the time. For me, that meant shutting my office down. The 2-week-old that was in the waiting room had to go get I am immunoglobulin so that she didn't get measles because she was vulnerable. We had to shut the office down for a week. We had to contact all the patients that were there um, after that child had arrived. It was just, um, it was a really big deal. And that child was so sick. I mean, we were able to keep her at home, but she was so, so sick. So, that's kind of the telltale presentation. And then you can just get this terrible viremia from it, where the virus is multiplying at such a high rate in your body that your body just can't deal with the virus doing that. And so you can die from getting pneumonias, you can drop your blood pressure and not be able to perfuse your organs. And the death rate is not insignificant. We expect 1 out of every 500 to 1,000 cases of measles is going to die. And so we're moving into a time where, we're several hundred cases of measles in the last year or so now. And we're all waiting to hear about the first death in the United States from measles in quite some time. And that will be a really tragic day when that happens.
Is it in Texas where there's a big breakout?
There's a big breakout right now in an Amish community in Texas that has a very low vaccination rate. And those cases are just exponentially increasing right now. Again, for every case that's there, you're going to get 15 to 18 more of the, susceptible people that are in contact with that person. And we have to watch people for 21 days before we can feel comfortable that they're not going to develop measles once they've been exposed. And so if you have an unvaccinated population, you're talking about putting those people, in their homes for 21 days while you wait to see if they're going to come down with it or not. It's extremely disruptive to the society, to the homes, and um, then you've got this risk of just having it spread like wildfire.
It's frightening, isn't it? And I remember hearing that pregnant women, it's not that the woman is susceptible to measles, but is it because the fetus can get the measles while she's pregnant?
That's more with rubella.
Okay.
So there's two different kinds of measles. So with rubella infection, which has been eliminated from the United States, we really only see rubella cases that are coming in from other countries at this point. Again, because the vaccination rates are so high in the United States. If a pregnant person becomes infected with rubella while she's pregnant, then that baby can develop congenital rubella. And that's a very serious disease that often we have hearing loss. Sometimes we have cognitive loss in those babies. Sometimes they die. That's not something that we want to see either. I don't believe I've ever seen a case of congenital rubella in my career either, and I'm hoping that we don't. But when we see people refusing to give their children MMR vaccine, that's measles, mumps, and rubella. And if we start seeing measles is, what we consider the canary in the coal mine, because you have to have about 95% of the population protected against measles to prevent outbreaks from happening. And
Okay. So
so we
95% protection.
95%. Yeah, it's very unforgiving.
What are we
And
at
so,
now? Do we know?
well, nationally, we're just under 95%, kind of hanging on when we look at 5-year-olds, the kindergarten population across the United States. But there are pockets in the United States where it might be 30 or 40%. And so those are the places where, the world is global, and you have someone come in like my little patient who flew in from India. And if they land themselves in a community that has very little community immunity against measles, then it doesn't take much for to, drop the spark in there. And then you've got these cases. There's a really cool simulator. that is put out by, gosh, I'm forgetting the name, but I will make sure you have it. But you can you can put in your zip code, find the nearest city. So you can put in Nashville. And on one side, you have a 95% vaccinated community. On the other side, you have an 80%. So it's not 30%, it's
Yeah.
80%. And you drop a case of measles in each of these communities, and you see that in the 95%, it's a case and a case and a case in a case, and then it kind of runs out. And in the 80% vaccinated community, it just blooms like
Hmm.
a nuclear cloud.
Yeah.
And that's 80%. And so some of these communities that are sitting at 30, 40, 50%, that's really, really scary.
It is scary, and it's I think, the way I see it is it's becoming almost a fad to get online. Now, people lie online, so we don't know if they're telling the truth, but it's a fad for these little influencers to get online and say, Mama, don't vaccinate your babies. Oh, no, no, no. I've got these essential oils I sell, and we can help you with everything that might happen to your baby. But it is sort of becoming a fad. And I even see in some groups occasionally where moms and dads who do vaccinate their children are almost being shunned and looked down upon by other people, like, well, you idiot, I can't believe you're doing that to your child.
Mhm.
But that's very disturbing. And I
It is.
wonder
And
how many
go
are,
ahead.
I mean, I guess every pediatrician that gets their own children vaccinated. I can't imagine any pediatrician that I've ever known not getting their own children vaccinated. I mean, I guess there could be a few, but I don't think our medical
There are
schools are
a
turning
few,
out
but
very many that don't, right?
a very, very, very small number of pediatricians that would not vaccinate their own children. Mine have everything they could have possibly gotten. Um, but to your point about this trend, where if you think about like COVID vaccines, the population that was most eager to get COVID vaccines was the 75 and up population. And it's because they saw all this stuff, during their lifetime. They went from kids that got polio in the summer and kids that got measles and kids that got mumps and kids that got diphtheria to really not seeing this in their own children and not seeing it in their grandchildren. And so they really understood the evolution of vaccines and how important they were. And what's happened to the younger generations is that vaccines are kind of their own worst enemy, the victim of their own success. They've never seen what a kid with measles looks like. They think, oh, it's a little dotty rash, and they'll get over it in a few
Mm-hmm.
days. And a lot of them do. But 1 out of 500 is not a small number of kids that are going to die from that. And, if you think about the crisis that happened in Samoa, in, I guess that was like 2018, 19, there was a nurse in Samoa that drew up MMR vaccine, and instead of drawing it up with sterile water like you're supposed to, they drew it up with a paralyzing agent. And why there was a paralyzing agent anywhere near routine vaccine vials is, subject for another conversation. I don't understand why that happened. But they vaccinated two babies with MMR vaccine that was mixed with a paralyzing agent. And so both of those babies died. And so before they understood what the reason was, the health ministry in Samoa banned the MMR vaccine. And because they were just sure that it was the MMR vaccine that had killed these kids instead of this, a healthcare worker's mistake. And so their vaccination rates dropped to 30, 40%. And they're an island, fairly well protected, but someone came over from New Zealand who had measles and entered this population, and their measles just overtook the island. And they had I think there were 85 deaths, almost all of them children. It completely overwhelmed their medical system. They did not have enough ventilators. They didn't have enough IV fluids. They didn't have enough medications. They didn't have enough hospital staff to be able to take care of all the people that were infected. And so there were literally people dying on the sidewalks and waiting to get treated for measles while they were there. And, if you think about taking the scale of that and applying it to a place like the United States, or even a major city in the United States, and what an outbreak like that could do to the healthcare system in that area, and the number of deaths that we could potentially see, it's really, really frightening, and really tragic. They did eventually in Samoa realize that it wasn't MMR vaccine that had killed those two children. They had a lot of aid workers come in, and they went door to door to vaccinate people on the island of Samoa. And when they finally got people vaccinated there, then that's when the outbreak ended. But not before they lost 85 people there, which is
Wow.
a
And
huge number.
when those things are happening, like here in the U.S., where we're seeing the measles outbreak and whatnot, it seems to affect the most vulnerable populations first.
It's almost always going to be the children that are going to suffer from the decisions that their parents are making. And and to be clear, parents are trying to make the best possible decision that they can for their children. And unfortunately, they've been subject to a lot of mis and disinformation. But sometimes when you're given a choice between two things, it feels safer to do nothing than to take the action to do the thing. And so if you have some questions about it, it feels safer. All of these parents are thinking ahead to how guilty will I feel if I give this child this vaccine and then something bad happens. That's where they are. It's just like when you're pregnant and you have a miscarriage, and then you're wondering, was it the French fries I ate, or the one sip of wine I had, or whatever it was, and that's a very, very difficult thing to live with. And so these parents are all trying to make the best possible decision. The problem is that they're being inundated with information that's very bad information, and then that's what's informing these decisions. And so when you have these parents who are then talking amongst themselves, then they start to grow communities of people who have made the same decision, like models like. And then you end up with these communities that have these very low vaccination rates. And then because of their decision to do nothing, and they're sharing that decision, they've actually made their children more vulnerable to having bad outcomes from that issue. So
do children to go to school now? Do children have to have had some basic vaccines? And what are these communities doing when they're trying to get their kids in school?
Yeah, every state in the United States has requirements for school entry with respect to vaccines. The problem is we're starting to see an erosion of that in state legislatures. We just saw this in Mississippi and West Virginia. So, when you think about high vaccination rates and the best health outcomes, you don't think about Mississippi and West Virginia.
No.
First off,
No,
the Mississippi and West Virginia only allowed medical exemptions for vaccines, and only about 0.1 to 0.2% of the population has a medical exemption where you can't get this vaccine because you're allergic to something that's in it, or you had some bad reaction. And even if you had a bad reaction to a vaccine, it doesn't mean that you're going to have a bad reaction to every vaccine. Right. So usually there's not a medical thing where you can't have any vaccines at all. Even if you're a kid in chemotherapy, there are some vaccines you can't get, but the vast majority of them you can and should get because you want to protect yourself. And so both of these states had only non-medical exemptions, or only medical exemptions. And as a result, their kindergarten vaccination rates were 98, 99% in those two states. Well, last year there was a challenge through the court system in Mississippi. And they said, the court said, well, if you have a medical exemption, you also have to allow a religious exemption. And so now Mississippi, for the first time ever, has to allow a religious exemption. And so immediately they got thousands of religious exemptions that were filed on behalf of students in Mississippi. And then in West Virginia, the new governor just made an executive order that they have to accept religious exemptions in the state of West Virginia. So those two states are going to see some significant decreases in their immunization rates, unfortunately. But every state has at least some immunization requirements in place. Most non-medical exemptions, so people who are either claiming a philosophical objection to vaccines or a religious one. And by the way, there are no religions that object to vaccines
I
with the
don't know
exception
one.
of
Yeah.
people who use faith healing in lieu of medicine. They would be the only ones. Um, they usually amount to something like 3% or so, but we're starting to see pockets now in Idaho, for example. I think their non-medical exemption rate is something like 8%. So
Mm.
we're seeing pockets of increasing rates. They're calling them religious exemptions. They're really not religious exemptions. They're philosophical objections to vaccinating, unfortunately, and they're using that as a loophole to get their children into public school, but not having to participate in the vaccine requirements.
I mean, and I'm guessing as a pediatrician who who has studied all these things extensively, that must be very frustrating. Let's talk a little bit about where kids get their vaccines. What percentage do you think get them from a public health office of some kind, whether it's the Department of Health or, Mercy Healthcare, whatever?
So I don't know exact percentages of that per se. I can tell you that about half of the children in the United States are covered under the Vaccines for Children program, which is a federal entitlement program that provides vaccines at no cost to those families. And so the wonderful thing about the VFC program, which just celebrated its 30th anniversary. In the United States, there's really not an economic reason why a child should go unvaccinated. They are either going to have private insurance through their parents, or they're going to qualify for the Vaccines for Children program. So any child who qualifies for Medicaid, if they're uninsured, if they're underinsured, which means they have commercial insurance, but maybe they have a grandfathered policy that grandfathered into the ACA that doesn't require the insurance company to pay for vaccines. All of those children are covered under the Vaccines for Children program. And also Alaska Native and American Indian children are covered under the Vaccines for Children program, even if they have private insurance. So really 100% of kids in the United States are covered. And about 50% of them are covered under the Vaccines for Children program. So sometimes children covered under the Vaccines for Children program can go to their local pediatrician. Not all pediatricians participate in the VFC program. About 85% of pediatricians do. So in some cases, they might be going to a local health department, or they might use a federally qualified health clinic or a rural health clinic to get their health care or their vaccines. But that is one program that we really do very well in U.S. healthcare, as opposed to on the adult side, where if you don't have private insurance, if you're not old enough for Medicare, and if you don't qualify for Medicaid, then there really isn't a great place for you to get a vaccine except through a federally qualified health center or maybe through a health department. But it's much, much harder to get uninsured adults vaccinated than it is to get uninsured children vaccinated.
Well, that's some comfort for sure. But now I have to worry the funding for public health facilities. I guess that could be at risk now, right?
Yeah, we're certainly concerned about the cuts that are being made and the unintended or maybe intended consequences of some of those cuts. And so there's a lot of whiplash right now. It's February 13th, where we're cutting off funding. Then the court says, no, you can't cut off funding, but we're cutting off funding anyway. But we're going back to the court. So everyone in kind of the public health space is just sort of sitting and waiting to see what happens with all of this. But we've seen the shuttering of critical rural hospitals. Tennessee leads the nation, or at least last I checked, led the nation in loss of rural hospitals because of financial issues. And the more we disrupt that safety net, the more we're going to put people at risk for things that we can otherwise prevent.
I think the thing that really scares me the most about some of these diseases coming back, and I don't know anyone personally. Well, I take that back. I did know someone who had polio as a child, and then later he had post-polio syndrome, I think they call it, where all of a sudden now he's unable to walk as well as he could. But I think the thing that scares me is that I'm not sure the turnaround is going to come until there's enough pain felt. And so it's like, how many cases of measles have to emerge and how many children have to die before people reverse their decisions on this?
Yeah, and we all really thought that COVID would be the fix to this, that that would have kind of stopped this anti-vaccine train in its tracks, because everybody wanted the COVID vaccines to come so that we could get through the pandemic. And you would think that the loss of 1 million plus lives in the United States, that I think in Tennessee we've gotten to like 1 out of every 280 people or something in Tennessee died from COVID. Why those numbers don't matter to people has, I think, mystified a lot of us. And we've said the same thing. Like this will eventually right itself, but how many people are going to die in the meantime while we're waiting for that to happen?
Yeah.
The other thing is, as you just mentioned, we don't have a good track record with viruses. So you talk about polio, and then down the road, you've got post-polio syndrome. Well, with measles, sometimes 10, 20 years down the road, there's something called subsclerosing panencephalitis, which is a uniformly fatal brain disease that a small but significant number of children who get measles and survive measles will get maybe in a decade or so. We've seen long COVID come out of this, out of COVID, and we're only 5 years out of it. And we have no idea what COVID is doing to kids who are sitting in schools and getting infected over and over and over and over again. You have hepatitis B that causes liver disease and eventually is the main cause of liver cancer. There are so many examples of viruses, chickenpox and zoster, shingles down the road. And 1 out of 3 adults is going to get shingles if they had chickenpox and didn't get vaccinated against shingles. I remember my great uncle had shingles all on one side of his face, including in his eye. And it was like that for years and years and years. He was in excruciating pain from that. We don't have a good track record. And so what we have never seen are late effects of getting a vaccine. We've never seen, oh, someone got a vaccine and 10 years later, because they got that vaccine, some bad chronic condition happened to them. We've never seen that. And so, if I've got to choose between getting a vaccine that might have a short-term risk that is significantly less than the short-term disease, or getting infected with something and then holding my breath to see what happens 10 or 20 years down the road, I'm going to go ahead and choose that vaccine option. Thank you. And so we've lost that perspective in the community, and with parents making decisions that, well, my kids already had COVID. Yeah, but they didn't need to have COVID 6 times.
Right.
They could have had COVID once. And maybe 10 years from now, we're going to see that kids who only had it once fare better than kids who had it 6 times. We just don't know.
Yeah.
They come out with these studies about learning loss that they attribute to the pandemic. But all of these kids have had COVID, many of them multiple times. And so how do we know that the learning loss wasn't from being out of school for a year and doing homeschool, but was because they've been infected by a virus multiple times that causes cognitive issues?
And now that school is back in everywhere, they're out of school repeatedly because they keep getting COVID again.
Right. Well, and we have this wave of mycoplasma that has come through where, I've never seen so much mycoplasma pneumonia in children. This is a bacterial infection that causes what people sometimes call walking pneumonia, where, you feel okay, you're not having huge fevers, or you cough like you're going to hack up a lung, and it goes on for weeks and weeks. And we would see preschoolers. I've never seen preschoolers with mycoplasma. And, every age group coming in day after day after day in clinic with mycoplasma. We know when kids get measles that it wipes out their immune system from protection from other diseases for something like 4 years. We don't have studies on what COVID has done yet, but couldn't it be possible, given what we know about other viruses, that having COVID affects your immune system and makes it more difficult for you to fight off other common diseases? And this mycoplasma epidemic happened in China last year, and this year it was in the U.S. So, I think in a lot of cases, we're not asking the right questions. It's people are drawing conclusions between X and Y when maybe we need to be pulling back a little bit and looking at the bigger picture.
That's a good point. And I because I'm not a physician and because I'm not employed as a physician, I can say things that you can't say. And one of my theories about some of this anti-vax movement has been that, as humans, we want to put blame on something for something bad that's happened. And I think some of these parents who have children with autism, it just makes them feel a little better to say, oh, it was because of the vaccine. Because really, I think the reasons for autism are unknown and may always remain so. We just don't know. We don't know why that exists. Then there are other unanswered things in the world that we just have to accept. We don't really know why children have, for example, Down syndrome. Well, I mean, we know what it looks like, but we don't know what actually caused it, And so I think that some of these parents, they point to, and I'm thinking of some famous ones actually who have a big audience. They point to that vaccine because it gives them an answer for what their child has.
I think that's absolutely true.
Yeah.
That it's in our nature to want an explanation. I mean, that's the first thing anybody asks. Someone has a seizure. Why are they having seizures? Somebody dies in a car accident. Well, why did they die in that car accident? What was the mechanism? What happened with that? Who ran into who ran across what? We want all the puzzle pieces so that we can paint a picture, and then that gives us some closure and some solace. And so when you have a diagnosis like autism, it's, you want, if you have another explanation, then it alleviates some of the guilt too, because I think it's also in our nature to think, like I said before, if you have a miscarriage, was it the French fry I ate? If my baby gets diagnosed with autism, is it something that I did? And that as a parent, I mean, that would just be a terrible thing to wrestle with and try to live with. What could I have done differently? And unfortunately, you've got people who are like the true anti-vaccine movement people who prey on these parents that want those answers and that have figured out that they can monetize that. So, well, yeah, your kid might have autism, but if you buy this $400 a month supplement, then that will help them. Or if you buy this concoction that I've made, it will detox them from the vaccines that you gave them, which is complete bull. Or if you put them in this hyperbaric oxygen chamber, it will fix this particular issue. Or if you read this book, I will tell you how you can, undo whatever it is that's been done to your child that has caused the autism. It's all a grift. And I really feel for these parents that are just searching for answers and have exhausted themselves, have exhausted their finances, sometimes to the detriment of their families, to their marriages, to their professions. trying to find an answer because there's all these people around them with a handout that are more than
Mm.
happy to lead them down another road of bunk, as long as it fills their wallets up. I wrestle with like the people who do that. Are they do they really believe what it is that they're doing, even though there's all this evidence to the contrary, or is there really some kind of pathology at work in these people that um, make them take advantage of those families that are seeking answers?
I'm going to go with option B because I think it's
Hard
been,
not to.
yeah, I think it's been proven some of them are actually getting their own children vaccinated, but they're, like you said, it's a grift and they're using it to make money. And plus, the internet, um, you know, now that actually there is a job category called influencer, who would have ever
Mhm.
thought? Now they can not only make some money, but they can be kind of well known and respected among these people that want to grab onto what they're pushing. Um, and it is scary for the rest of us. I remember during COVID, I became so frustrated at the people who were speaking out against the vaccine because my neighbor died of COVID. And he died right as the vaccine was actually rolling out. So he just didn't have the chance. And I also became very frustrated and mad because anytime you said, well, so-and-so's died from COVID, then the first question the person would ask, instead of saying, oh, I'm so sorry, they would say, oh, did they have underlying conditions?
Mhm.
As though those among us who are not in perfect health don't matter anymore. That's sort of what it felt like. And, my
we hear that
neighbor's
with
underlying condition was he was over 70, but he was a 72-year-old who retired from his job and bought himself a red Corvette and drove it to Starbucks every morning and to the golf course and lived life to its fullest. And he got COVID and died. So I would get so frustrated when I would hear that. Underlying conditions. Well, that's what that was about.
Absolutely. We've had 57 children die from influenza this season so far that we know of. 57. And historically, more than almost 100% of kids who die from influenza are unvaccinated. And more than half of them are completely healthy children. And so it's not, the kids that we see hospitalized for respiratory syncytial virus, the vast majority are normal, healthy infants that are being hospitalized. And but I feel the same way. I would get the same thing when I would talk about children dying from COVID, 900 and something children under the age of 4 dying from COVID. And that would, but they must have had some kind of underlying condition, which I mean, especially as a pediatrician, just absolutely sent me over the edge to say, well, so that doesn't matter. They're expendable. If it had been a healthy kid, that would have been different.
Yeah.
Um,
It's a
but
devaluing of life.
exactly. But over and over again, we see that no, at least half, if not more, of kids that die from these completely preventable outcomes are kids that are healthy kids.
Very sad. So let's talk about bird flu. What do we know about
Mm.
bird flu? Should we be afraid of bird flu? What are we going to do about bird flu?
That is a big, big question with a lot of question marks. So what we know about bird flu is that this is an influenza that was in birds that made a jump to cows. It is never good when a virus that is with one kind of species of animal jumps into a mammal like that
Okay,
because
so that's
cows are
like that's
closer
a
to
red
us.
flag is when it goes from one.
Right.
Okay, all right,
Yeah, because cows are closer to us, being
right.
mammals, than birds are, which are flying lizards. So, that's not a good thing. And then what you worry about is, so now we have a very, very high seasonal influenza burden right now, highest in about 15 years, because one, people were holed up during the pandemic, and so there's probably some loss of immunity, or maybe COVID has influenced immunity. And two, the flu vaccination rates have plummeted. And so we know that when you get a flu vaccine, you're much less likely to end up in the hospital or dead, even if you do end up with the flu. And so if you have, let's say, a dairy farmer who is working with a herd of dairy cows that are infected with bird flu, and you get seasonal flu, and you also get infected with bird flu, then that person can be a reservoir where those two flus can interact with each other and swap genetic material and
Mm.
potentially come up with another flu that can be spread from human to human. We have not seen human to human transmission yet with bird flu, but that's what the concern is this season. Why it's so important that people who work in industries where they're interacting with poultry or cows that are infected are vaccinated against seasonal flu, so that we don't unintentionally have a reservoir where there's some mixing of that, because that's how these flus get around and make the jump from species to species or person to person, is that they swap genetic material. They if there's an advantage to doing that, or you can kind of duck under the immune system and make copies of yourself. Your only business as a virus is to make copies of yourself and go on and infect the next person and kill them. That's what they're trying to do. And so that's worrisome. So it's good that we're not seeing human to human transmission. That's great. It is concerning that it did make the jump from birds to mammals. And the other good news is that those cases of humans that have contracted bird flu, largely from either backyard flocks or other poultry or from dairy farms, have had relatively mild symptoms. There was a man in Louisiana who died, who was an elderly person with lots of comorbid conditions, but he didn't get it from another person. He got it from his backyard poultry flock. So that's all good news. Can it, in an instant, make a change and make a jump? Yeah, it can. And so, thinking about what we thought about with COVID, that could be a situation where we really recommend that people are masking in public and staying out of crowds, and hopefully we'll have antivirals at least that make a difference. Oseltamivir is the medicine that we typically use for seasonal flu, and usually those medicines hold up with other types of flu. And there are vaccines at the ready for bird flu if it should come to that. There are vaccines at the National Strategic Stockpile against that. They just haven't felt like there's a need to deploy those yet because we're not seeing human to human transmission. So in some ways, we're in a better situation than we were with COVID, where there were no vaccines, there were no antivirals, there was nothing for a good year. In other ways, we're worse off because we've had so much turmoil in public health, where we're seeing loss of funds, loss of infrastructure, and then the community. How much would they tolerate being told that they should wear a mask and go get vaccinated and
Oh,
stay
they're
home
not
when
going to
there's
tolerate that at
and
all. They're not going to
yeah,
tolerate that at all. I mean,
yeah.
I'm afraid that is not going to happen. So I had no idea that we had a stockpile of vaccines, and I'm glad to hear that, because that would be the route that I would have to take.
Mhm.
Because I don't think there's any appetite at all now for anybody being told what to do, pretty much about
Yeah, so I
anything.
think you know, uh, I think most people will do, kind of as they're doing now. They kind of self-assess to their level of tolerance of risk. And still now there's, I won't go on an airplane without a mask. I'm not going to sit in an airplane for hours next to someone. There have been studies to show that for every hour you're on an airplane, you increase your risk of getting COVID by something like 5 times. So I do a lot of air travel, and I do not get on a plane without a mask. But if I'm passing through a place where, I'm not going to be around the same people for more than 15 minutes or so, I don't necessarily wear a mask in those conditions, but I see people who wear a mask to the grocery store, which I don't do. So, everyone has kind of determined what level of risk they're comfortable with. And I won't say if, but when we have, a next pandemic, which I feel very certain we'll see in the fairly short term. Um, those people who take precautions are going to be taking precautions for themselves and for their own families, and we're probably not going to be
Mhm.
able to expect that society as a whole is going to follow that kind of guidance.
Right, right. So the herd immunity everybody talks about is not probably going to work, you know.
Possibly not.
Yeah. Um, well, let's talk briefly then about just to finish up the bird flu conversation and to wrap things up here. I just hear that about the best things we can do about that are to really cook our eggs well, cook our poultry well. I mean, that's really about all we can do, right? The average person. I mean, I've got friends who
Yeah,
say, I'm going to become a vegetarian. And I'm thinking, no, I'm not. But
well, eggs are pasteurized.
right.
I mean, drinking raw milk is a very bad idea.
Yeah, I would
So you want
never
to make
do
sure
that. But I know that's a
milk is,
fad now. Yeah.
it is, unfortunately, that who would have thought that, the idea that if we heat milk up a little bit and it kills bad bacteria, would become some kind of, crazy stand to take.
I
So
know.
yes, drink pasteurized milk, eat pasteurized cheese, eggs are pasteurized. We know that there's bird flu virus in unpasteurized milk, so wouldn't be a brilliant idea to drink unpasteurized milk. If you can afford to get eggs, I think my husband had to go to two grocery stores this weekend to get eggs, and they were about $10 a dozen. Then yes, you should cook them thoroughly. Chicken, even without bird flu, chicken should be cooked
Yeah.
thoroughly.
Yeah.
Um, and then, things like the wild bird population, it has a lot of infection in it. So if you're a bird enthusiast like I am, I still have bird feeders, but I go out and I feed my birds and I come inside and I wash my hands, because, who knows, there might be bird flu there. If you have backyard flocks of, if you have chickens or, some other birds that you attend to regularly. Make sure that you're washing hands, and you might even want to wear a mask if you're out there feeding your chickens or cleaning your coop or something, to make sure that you don't get exposed to that. And again, even those people who have gotten conjunctivitis and mild disease, so not a big deal, but you never know when a move into humans is going to be a spark that ignites something larger. So just good common sense. I don't think anybody has to go crazy about any of it, but hand washing goes a really long way. And so wash your hands before you touch your face or eat or drink anything, and that'll keep you safe from a lot of stuff.
Yeah.
Not measles, but a lot of
Yeah.
other.
Yeah. Oh, that's good advice. Well, Shelley, if someone wanted to, let's say that I have a listener who's on the fence about vaccines, what kind of resources, where should they go to do some reading to learn so they can make their best decision?
Well, I have lots of good places for resources. So one of my favorites is healthychildren.org. That is the parent-facing site of the American Academy of Pediatrics, and they have wonderful articles. They have one in particular that I really like, which talks about vaccine safety and goes through kind of all the different safety measures that are taken, and um, talks about studies and how clinical trials are done and all of that. So I think that's a really good resource. There's a website called Vaccinate Your Family that has wonderful resources. There's Families Fighting Flu. There's Voices for Vaccines. If you don't want to go to, a governmental site, those go to get good information. And then just your family doctor or your pediatrician, your school nurse. Those are all really good resources for good clinical information. The one thing I will say is that, and I get tricked by this too, there are websites that sometimes sound like they're credible websites that really are not. And so the other place I would direct people are to medical center websites like Mayo or Children's Hospital of Philadelphia as a wonderful vaccine education site. Vanderbilt, other big institutions, medical centers. There is not, I tell people this all the time, if your child was super sick, you would take them to a children's hospital. There is not a children's hospital in the United States that would tell you not to vaccinate your child. So those are really good places to go for good.
I mean, that's just pretty much the end of the discussion, right? There is no children's hospital that will tell you not to vaccinate your child. That's amazing. Yeah. Well, there you go. Well, this has been very interesting. I've learned some things. I think that the listeners have learned some things too. I hope they have. And the resources are great. We'll put those in the show notes for sure. If somebody wants to keep up with you, Dr. Fiscus, how would we do that?
Probably the best way to do it is to reach out on social. I have dropped Twitter, but you can find me on Blue Sky at Dr. Fixus, Fixus, or on LinkedIn. If you want to send me a message, I'm happy to answer you back.
Fabulous. Well, thank you so much, and thank you for what you are doing. I know that the work you are doing is the kind of work in public health that you could make a whole lot more money if you chose to do your medical career a different way, but you have dedicated yourself to working to help us be healthier and help us have healthier generations following us. So I really appreciate that.
Thank you. I hope that's a point that people realize that, anyone who is in public health, first I will say that pediatricians are the public school teachers of medicine to begin with. So, nobody goes into pediatrics to make money. The only place where you can go and make less money, I think, is in public health. So, the career public health people that are there, the ones that have been working at CDC for decades, Dr. Fauci and others, they are not there to make $1 million. They are there because they feel very, very strongly. They have a calling to help make people healthier and to stay well and to prevent things that can be prevented. And that's what we all do. There's no grift attached to what we're doing. And if tomorrow there were good, credible studies that came out that said, oh, you really shouldn't give this vaccine, we wouldn't do it. But, we continue to see research that shows that vaccines are the best tool that we have to prevent diseases that can cause some really devastating consequences.
Very true. Well, thank you so much for being with us today. I appreciate you and your friendship and your steadfastness in this line of work. We may have to check back later when the next pandemic comes along.
I hope we're both old and gray, but we'll
too.
See. It's been great fun and a pleasure to be with you, Peggy. Thanks.
Thanks a lot, Shelley. Have a good one. All right, listeners, if you really enjoyed this episode, make sure you like the show and share it with your friends. And again, if you think you would be a great guest or know a great guest for us, hey, send me an email and let me know. And the email will be in the show notes. We'll check y'all next time.